There have been worries and concerns at the increasing rise in the cases of sudden death in the country. There have also been many reported and unreported cases where some individuals slumped and passed on while sitting down, discussing with loved ones, or during a productive activity. Sudden death is a tragic event that can occur due to various reasons. Dr. Oladehinde Ebenezer, Medical Officer of Health at Amuwo, Odofin local government area of Lagos State, listed some common causes of sudden death.
The common causes of sudden death are, number one, underlying health issues. Number two, socio-cultural issues. Number three, medical emergencies. So I'll take it in that category. Underlying medical issues, I mean there are so many people, irrespective of age, that are not mindful of their health. Being mindful of your health starts from being conscious of the way you live. The way you live, I mean what you eat, your diet. The way you live, I mean how regular you participate in exercise. The way you live, I mean being exposed to medical checkup. The fact that you are young, the fact that you are old does not mean that you shouldn't eat well. Does not mean that you shouldn't participate in regular exercise, and does not also mean that you shouldn't go for checkup when due. If I go to the second category, social issues, there are so many issues, economical, family, political issues that are going on in the world now. Nigeria is not exempted. Lagos is not exempted. In fact, all communities are affected. We have the inflation, we have the other issues that affect peculiar community. We have social vices, we have kidnapping, we have so many of those things. They will affect our health. They will tell on our health. So the first thing I want us to do as Nigerians, as Lagosians, is to be mindful that everything boils down to our health. And then, irrespective of our age, we need to go for checkup regularly. I am young does not mean you can't have hypertension. I am young does not mean you can't suffer stroke. I am young does not mean you can't suffer heat stroke. The weather too is becoming extreme these days. So all these things can be causes of sudden death.
According to him, hypertension, mental health, and harmful habits, including drug abuse, also contribute greatly to sudden death, especially among the youth.
Common in this our environment, hypertension and diabetes. They come up. The other one is hyperlipidemia, commonly called high cholesterol. These things are very common. The third one is mental health issue. In fact, we found out that our young population, they have a lot of mental health issue. Right from setting priorities, right? A lot of them, they want to blow using their language within short period. No, life does not work like that. A lot of them are indulging in hard substances. It may be smoking, it may be drinking, it may be other harmful health practices. These things they will eventually tell on your health. I will tell you from practice point of view, we are seeing young people with unreasonably high hypertension. I am seeing people that are saying that I have not slept in 2-3 days. Some in 1 week. They will not tell you the underlying. By the time you dig deep, you see that they are indulging in hard drugs. You see that they are indulging in smoking. These things eventually tell on our.
He urged Nigerians to be mindful of their health and learn the warning signs of cardiac distress and how to respond in an emergency.
A lot of time, there are no signs. In fact, we call hypertension sudden, we call stroke sudden disease, because a lot of time there is no sign. You can be living your life, not checking your blood pressure, assuming that everything is okay. So 95% of time, hypertension may not show you signs. So it is the role of that person to expose himself to either regular check at the clinic, regular check at the hospital, or regular check at home. You must be informed about what is normal about your health. In fact, there is this term about what are your numbers. by your numbers we need. What is your blood pressure? What is your pulse? What is your heart rate? What is your diabetic values? So we need to be familiar with what is normal so that we can check. The other one is that sometimes there are signs. In the 5% of the time that there are signs, people does not put attention on those signs. Sometimes it's fatigue. You are unnecessarily fatigued. Sometimes it's easy fatigability. Before you walk distance, you are tired. Before you run, you are tired. In fact, some people, when they sleep on their bed, they can't breathe well. These things are subtle signs that can also be helpful if we put our mind there.